Ladies and gentlemen, our webinar is going to begin. I'm Steve Love. I'm President and CEO of the DFW Hospital Council. This is another one of our educational webinars. We're delighted that we're going to host this in coordination with Accenture, who is an associate member here at the Hospital Council. Today's topic is Texans Want Virtual Healthcare. Here's how providers can grow from it. This is a complimentary event to examine a groundbreaking Texas survey that Accenture did detailing the uses of telehealth, especially during COVID-19 and this pandemic that we've all been experiencing. The survey revealed over twice as many Texans utilized telehealth following the virus outbreak. This is a fascinating topic, and it continues a trend of trying to bring the latest information and some of the latest developments in healthcare. We've got three excellent speakers today. Mark Olney is the Managing Director of Health and Public Service at Accenture. Chase Parks is a Senior Consultant at Accenture, and Laura Zhang, a Senior Strategy Analyst at Accenture. We welcome those three speakers, and at this point, I'm going to turn it over to Mark Olney. Welcome, Mark.
Thanks, Steve. Thanks for all your help putting this together. We really appreciate it. So I want to talk to people a little bit, give you a high-level overview of kind of what we did and why we did it. And then Laura and Chase will take you through a lot of the details. So, we initially were doing some research around telehealth about a little more than a year ago. It'd been about 2 years after Senate Bill 1107 passed and the Texas Medical Board had opened up some of the restrictions that we previously had in Texas around telehealth. And so we approached this in the fall of 2019 to really look at, what were the barriers to telehealth and, why was Texas, some of the statistics we looked at, Texas was about number 48, 47 as far as usage of telehealth per capita. And so why was Texas so low? And so that was really kind of the beginning of our survey. So we did that, and we looked across a number of different areas to try to triangulate. We talked to 13 different health systems in Texas, representing more than 50% of the beds in Texas. We did an analysis of claims data. We did a consumer survey, so we did some primary research going out to consumers in November of 2019. We were getting ready to publish kind of our study and our results back in January of this year. As COVID was starting to hit, we decided to hold those results. And then what we ended up doing was kind of a post-COVID or during COVID, but after the initial wave of COVID, and looked at telehealth and compared, what were our theses, hypotheses before and after, and how did those come true? So it was a very interesting study. This is all about Texas, and we really had a great baseline of right before COVID. How was telehealth working? What were the challenges? What did we need to do moving forward? And then, we looked at it right after COVID. We redid some of our primary research. We redid our consumer survey. We talked to a number of health systems kind of post-COVID. So I think you'll find some really interesting information out of that. Kind of a unique opportunity we had due to the fact that we'd done the survey right beforehand. So let me now turn it over to Chase and Laura to go through the detail.
Awesome. Yeah, thanks so much, Mark, for that intro. And thanks, Steve and Chris, for kind of setting everything up behind the scenes. We're really excited to present our research. So very similar to what Mark alluded to, we kind of had two chunks of work. So the first was really talking to these 13 provider systems prior to COVID and really getting their take on what are the key challenges when it comes to first implementing and then scaling virtual care. And then our second chunk of work will be today's focus. So what we wanted to do, like Mark said, was understand consumer insights when it came to virtual care usage and trust in Texas, both prior to COVID, so that November 2019 survey that went out, as well as since COVID started and kind of that first outbreak. And so kind of throughout today's conversation, we'll really talk through first key insights that we've seen from our consumer POV regarding insights, regarding consumer opinion towards trust, use case specificity, and access to virtual health care. And then we'll kind of go into the rural and urban nuances when it comes to kind of that consumer demand. So obviously there are nuances between the rural, urban, and suburban markets. And so we'll get into that a little bit, talk about the role of independent physicians when it comes to building a Texas coalition around scaling virtual care and kind of leveraging the provider's trust or the provider's brand as a trusted, healthcare guide when it comes to consumers getting healthcare. And then the last piece that we'll really hit on are next steps as we continue to respond to COVID and this increasing consumer demand for accessibility and convenience. So kind of centering on this slide, what we've seen in the past couple of years, and especially in the past couple of months, is this flurry of activity. There have been changes in reimbursement mandates, a loosening of, or changes in mandates when it comes to CMS and within the state for reimbursement. We've seen consumer demand for telehealth, first because it was very convenient and on demand, but now since COVID has started, what we've seen is it's become a necessity. And then we've seen kind of this blow up of so many different startups and different acquisitions in the market trying to create this holistic journey for the consumer. So what we wanted to think about when we took a step back was, for a Texas hospital system, what made sense in terms of first implementing telehealth and then scaling it. So what we really wanted to anchor it on were the significant opportunities along these 4 points. So the first is taking a step back as a health system and understanding that telehealth is merely a means to an end, right? Essentially, at the end of the day, you're trying to get healthcare to your patient, you're trying to meet them in the middle or wherever they're at. And so it's really all about understanding what your strategic market entry point may be, whether it is trying to create more consumer intimacy with your already existing patients, or trying to get into a new market altogether with potential new customers. Really understanding that strategic vision and purpose will drive so much of the subsequent work. The second is really, of course, understanding your consumers, right? There's a lot of digital behavior growth outside of health, even before COVID, and especially after, well, not even after, since COVID, that requires understanding how other industries are catering to consumers via accessibility and convenience. I mean, look at Netflix, look at Uber Eats, the ability for bundled offers and transparency with price and wait time, and how can the healthcare market kind of learn from those other industries. The third is understanding that you can't do this alone. At the end of the day, it really is all about building a coalition, and especially within rural and underserved communities where there may be a digital divide, or where there may be just kind of trust issues when it comes to healthcare in general, and then healthcare via some sort of technological device. And then the fourth is understanding, at the end of the day, you don't want this to be another burden on your providers. And so understanding that you have to basically bake in and absorb this new capability, potentially net new, potentially improved capability with your hospital system into the existing clinical workflow in order to reduce clinical administrative burden and ultimately focus on what matters with virtual care, which is getting to the consumers and getting to the patients that need it the most. So these are some points to begin thinking through as we walk through the webinar. And now I'll pivot over to Chase to kind of look through what some of the main consumer insights we've garnered from our telehealth study.
Thanks, Laura. I will apologize in advance. Just as we were beginning this webinar, someone outside my place decided to start leaf blowing, so I apologize if there's any background noise. So as you see here, the 4 stats you see tell a story from our survey as we move across. We see how many people learned about telehealth, how many people started using telehealth, what the demand to keep telehealth is, and ultimately, what is the priority for Texans when it comes to using telehealth? 25% of Texans learned about telehealth during COVID. And I'm sure many in that 25% found out when their doctor's office called and told them that they would be having a virtual visit instead of coming into the office. I can relate to this in a way. While I was already aware of telehealth, I have an annual checkup with my PCP this Friday, blocked off my calendar, and had every intention of driving to my doctor's office. However, yesterday I received a call from my doctor's office telling me that I'd be having a telehealth visit, and if I had an iPhone, because my doctor would like to FaceTime me. It's kind of an aha moment for me, thinking that I was about to drive to my doctor's office on Friday, and of course I would actually be having a virtual visit. I think the stat shows that obviously there's an untapped market before the pandemic. 4.5 million started using telehealth services. This is from things from common preventative care, annual checkups, but also mental health, which we will be diving into more in the presentation. 89% of Texans think telehealth should be available to everyone going forward. I think this is a pretty strong endorsement for telehealth to be an option and part of the care model as it continues to evolve with digital technologies. And finally, 2.5 more Texans prioritize not getting sick as a reason for using telehealth. While telehealth has always been viewed as an alternative to travel and for convenience, it is now viewed as a deterrent to getting sick, whether it's from COVID or from something else. These 4 stats are a great representation across all demographics surveyed, but we wanted to dig into some of those demographics specifically around rural and urban demographics, which Laura will cover next.
Yeah, so when we are looking specifically first at the rural market, so there is rising consumer interest, and so there's a lot of demand that's risen, and I'll talk a little bit more about that a little bit later on, but from a supply perspective, it is really dwindling. It has been for a long time. So as you can see in the stats, there's really a lot of increasing hospital closures. I mean, ever since 2010, 40% of rural hospital closures nationwide have occurred in Texas, which is kind of alarming when you think now that there are roughly 160 rural hospitals that serve around 12% of the Texas population, but they cover about 85% of the state's geography when it comes to emergency and local care. So, I mean, when we were just doing research about just the rural Texas market, when it came to healthcare and accessibility to that healthcare, I mean, the number of anecdotes I had read, and also when we were talking to those 13 providers and really asked them about the need of healthcare access and virtual care in these rural markets, it was always about, transportation issues. It was always about having to drive, maybe like 5 hours to Austin to see a specialist, a mental health specialist or something like that, and then having to drive back home and, really being hindered by this need to physically get somewhere rather than being able to, like Chase said, throw up your FaceTime and talk to your doctor. And so what we've seen is that the rural Texas market is completely unsaturated when it comes to providing access to care virtually. And because of this lack of healthcare access, and perhaps due to this, a lot of rural Texans now trust virtual visits more or equal to in-person office visits. So that was actually a very interesting statistic that we've seen in our since COVID consumer survey, because prior to COVID, so around November of last year, of 2019, we saw that roughly 39% only trusted virtual visits more or equal to in-person visits. So that meant that the overwhelming majority just had a huge mistrust of virtual care, of using technology for getting healthcare. It felt very impersonal, kind of all of those longstanding conceptions when it's come to virtual care. And now it's roughly half-half. And so what we've seen is this demand has been increasing. We've also seen that with behavioral health, right? And so 185 Texas counties lack one single psychiatrist. And so when we think about this, and one of the providers that we had spoken to based out of Austin was talking to me about one of her doctors who was talking about this one patient of his who would literally drive back between, I forgot what the small town was, but would drive to Austin like every other week just to see him, just for psychiatrist care. And so now, ever since he's implemented telehealth, that has no longer necessarily been an obstacle. With behavioral health, I mean, that has been also a huge use case in rural Texas specifically, of course, throughout our nation, especially given the pandemic and social isolation and loneliness, and then also this need for human interaction that we may not necessarily be getting as we used to. We kind of see a lot of behavioral health startups and acquisitions happening in this space. So from a recent behavioral health study published by Accenture, I think July of this year, so very recent, only 43% of adults that are diagnosed with some sort of behavioral health condition are receiving treatment for issues. And as we know, behavioral health permeates everything that we do, right? And everyone has some sort of version of it. And so what we see is that it's really a value multiplier if we're able to provide behavioral health in a virtual care capacity to communities and people that need it the most. And that same study cited that 1% increase in treatment for behavioral health disorders could yield roughly $2.5 billion in medical cost savings. And that's not even considering just quality of care. One thing that has been kind of an issue when it's come to implementing telehealth that we're very cognizant of is the digital divide. So roughly 50% of the Texas households that don't have access to broadband or steady service are located in rural Texas. So from our point of view, rural Texas, from both a need and supply perspective, are desperately undersaturated. However, in order to really scale and build in this specific space, it requires working across various different coalitions within the community, across telecommunications companies, across state regulators, in order to understand how we can access this, or we don't want to access it, how we can tap into this digital divide to really address a lot of the issues when it comes to broadband infrastructure, as well as multilingual initiatives, and making sure that people who speak another language are able to also take advantage of the potential of virtual care. And then when we go into urban areas, what we've seen is that, we're very saturated with telehealth opportunities, with these convenience notes. However, there is a very interesting opportunity when it comes to urban and suburban areas. So we see a lot of players in this market, and not even really dealing with virtual health, but in general, when it comes to new entrants in the Texas market. We've seen CVS, we've seen Walmart, we've seen Amazon, Walmart and Oak Street. We've seen so many different players attack the Texas market and really get down to why consumers are interested in virtual care and why they're interested in potentially these retail health clinics or more consumer-centric care, is because of that ability to just snap your fingers and get what you need with 100% transparency, or as close to transparency as you possibly can. And so what we've seen with our survey regarding urban and suburban residents in terms of their interest in using telehealth, it really focuses on that notion of convenience. It's a lot easier for me to sit at home and FaceTime my doctor than it is to drive 10 to 15 minutes to get to my doctor. And that's for me, someone who actually has a car and doesn't have to rely on, the DART system or scooters, I guess, but yeah. And so that's something that we really need to understand, is that health systems, and we'll talk about this a little later on, but health systems have such a unique opportunity to leverage existing trust with consumers and patients to really drive the orchestration of their brand and orchestration of a consumer's care journey, to really, again, cater to the convenience portion of it, cater to hey, I'm willing to offer you virtual care. I think you should try it. Will you try it? What we've seen is that, again, like Chase mentioned, 2.5 times more Texans are willing to use virtual care now, mostly because they want to get away from other sick people. And so when we think about how we can expand that into however long COVID will continue and however long consumer sentiment feels regarding that space, we could really make a dent in terms of creating that consumer-centric service that's not just an episodic type of care or a one-off kind of care, but rather, you know, we are with you, and we, as in the health system, we're with you throughout every step of the way. And we understand your needs, we understand your accessibility issues, and we understand that you belong in this integrated care model, and here, trust us, let us guide you. So, you know, there are nuances between the urban and rural markets, between younger and older age demographics. But essentially, you know, with this emphasis on convenience, a lot of players have repositioned themselves and anchored themselves to this consumer centricity and orchestration, and they will continue to. And so as we are seeing a lot of these market signals with telehealth, with those 3 examples or those 3 logos on the bottom, which are absolutely non-exhaustive by any means, both nationwide and within the Texas market, you know, we can really think about using telehealth as a way to extract and curate customer intimacy and trust. And again, hospital systems definitely have a leg up when it comes to this relationship of trust with the consumers. And so what we will next talk about is kind of expanding on the level of trust with how health systems can work with independent physicians in the Texas market.
Thanks, Laura. So when it comes to independent physicians, Texas is unique and has been considered one of the last strongholds for independent physicians in the country. Texas has a higher amount of independent physicians compared to the country as well. And at the height of the pandemic and shutdown, Texas doctors reported significant drops in revenue due to the pause in elective surgeries. A large percentage applied for financial assistance and saw a heavy cut in work hours. Independent physicians are continuing to struggle even as the state continues to open. These independents have the opportunity with health systems to collaborate and partner and leverage consumer trust in those independent physicians to improve trust in technology platforms and specifically telehealth. So the question is, how can health systems and telemedicine help? Well, the question is, how can health systems and technology help? I think the help is mutual. Health systems can provide services and technology at a market rate to benefit independent physicians needing a permanent telehealth solution for the long term. As Laura mentioned, consumers, providers and health systems are shifting their focus towards consumer sentiment. Consumers have acknowledged that they want technology to remain. Specifically, local health systems, partnerships, and startups can be better support systems for providers and their patient populations, leading to natural synergies in the community. If the Texas market is able to partner and collaborate with these independent physicians, there's a better chance of consumer loyalty and consumer adoption with brand names that patients know and trust. This mutual help circles back to the point of the trust patients and consumers have in these independent physicians and providers. Physicians and other clinical practitioners can help maintain the crisis era momentum of telehealth services use as consumers look to them for motivation. Trusted healthcare professionals is an important factor in motivating consumers to take more of an active role in managing their health. As technology becomes more ingrained in our day-to-day lives, providers and health systems have the ability to leverage that technology to engage their patient population to take that active interest in their health. So what is key for health systems? And Laura, if you can move to the next slide, please. Circling back to the executive summary at the beginning of the presentation, there are 4 things we think that healthcare systems should consider as they look to position themselves in the market. Reimagine the strategic position, purpose, invest in the digital front door, integrate healthcare into care models, and partner with ecosystem players. Providers need to grow. When it comes to reimagining the strategic purpose, providers need to grow in untapped markets, whether it's a new market and partnering with some of the new players in the health space and telehealth space, or creating a project that directly competes and beats out those non-traditional players, leveraging your brand name, patient loyalty, and trust. Moving into those untapped markets will be vital to retaining patient trust and loyalty. Patients and consumers are willing to receive virtual care from a variety of sources, whether it's the traditional providers and health systems, retail pharmacies, or startups. If these traditional providers and health systems aren't able to virtually accommodate patients for the long term, another source, like the Walmarts, CVS's, and Oak Streets of the world, will. The balance, of course, will come from value streams. What strategy makes sense for a health system or a provider will tie directly to the bottom line. Investing in the digital front door. Patient access in the digital space is a popular topic in healthcare right now, and will continue as patients look for healthcare to integrate further into their lives, like so many other industries do from a technology perspective. Whether that's Amazon and next day delivery, whether that's Netflix and streaming, patients are going to expect technology to integrate further into their lives when it comes to healthcare. This is why the use of technology to reach patients across the continuum of care is vital when investing in the digital front door. Providers and health systems can also look to improve scores and reduce readmission rates through more frequent touch points with patients, leveraging all members of the care team. It doesn't always have to be the physician making that connection and touch point. Health systems need to leverage physician assistants, nurse practitioners, and the nursing team alike to create those touch points. Those more frequent touch points will allow the health system and patient to engage more frequently, identifying where patients are in need of more assistance in care. Amid the pandemic, consumers with nowhere else to turn were forced to lower their expectations for quality of digital health experiences. But as things normalize, we believe that consumers will revert to prior expectations. And this is when we will see an optimization and adoption of telehealth and telehealth services. Now is the time to invest in high quality digital experience and earn customer loyalty for the future. Integrating telehealth into the care model. To Laura's point earlier on mental health services being crucial to rural markets as less access is being seen county to county. Integrating a telehealth platform across the enterprise and care model result in a better experience for the patient and the provider. There's nothing more frustrating for a patient who is now during the pandemic used to seeing their provider through the same platform, same telehealth experience every week or every month, depending on their case, and that primary care physician or that provider recommending that patient see a specialist who is using a different platform. That struggle for the patient to adapt to that new platform when they're only really concerned about their care is something that will turn off and lead to distrust in technology that is going to be vital as we look to integrate technology further into the care model. Care providers, especially doctors, do not want to spend precious time that could be applied to other areas that add value to the consumer experience. Digital and virtual health solutions can be better can be part of the process, business model, and workflows fitting inside the way healthcare is delivered. Healthcare organizations can put in place systems that allow providers to recommend digital services to patients and collect and interpret patient data from these services. And finally, looking at partners with ecosystem players. COVID-19 forced digital health to fit into the clinical day-to-day workflow. More providers gain comfort with digital. Payers and providers should review data insights to analyze what works and what worked and what didn't work, and adjust digital services accordingly. As providers and payers look to expand their telehealth services and market into different areas, what did and did not work will be crucial to aligning health systems' future state vision with patient and consumer expectations. As mentioned before, leveraging the trust that independent physicians have with their patients and partnering with vendors that have the capabilities to scale will be vital to that partnership with ecosystem players. And finally, from a hardware perspective, rural and underinvested areas need access to broadband infrastructure for all this to work. The investment in broadband infrastructure will be vital to tapping into new markets in the rural area as telehealth services become the new norm in our day-to-day lives. With the data and recommendations presented today, we believe Texas can position itself as a leader in the digital and telehealth space as we continue to work through the new normal and a post-COVID future. Thank you for your time today. Please feel free to reach out to Mark, Laura, or me at any time. Thank you.
You know, Mark, I think we got a few questions that have come in. If that's okay, if you guys want to take a few questions.
Absolutely, that'd be great.
You know, one of the questions somebody brought in, and this is kind of interesting, with a lot of the schools having to go virtual, and a lot of places are having to put in hotspots, or they're at least trying to look at broadband. Do you think in some ways those could also be used to help some of the rural areas increase their broadband? Have you thought about that, or, you know, since you've done this survey?
Yes, I can take that one. So yeah, we've actually, it's interesting. I have a client that's been talking to a number of the rural kind of broadband type people to look at that exact topic around how to provide both of those. It's a definite need there. So I think that is a great way to kind of get 2 for 1.
Good answer, Mark. I like that. Here's another question we've got. How do you address the lack of technology other than broadband or handheld technology related to healthcare? Who do you think can afford and provide the broadband?
Yeah, I can take this one. So this is kind of one of the jackpot questions, right? Of really whose responsibility is it to provide. Again, so the broadband is one conversation, but since the question kind of marked specifically the other aspects. So you're right, like having the devices in order to do that, right? Like the laptops, the tablets, even the phones. So, you know, here at Accenture, we're working out this social determinants of health offering, which is essentially what this question alludes to, is really who bears that responsibility of making sure that people are able to have the digital infrastructure to engage with healthcare professionals virtually. And I think that answer, I mean, there's a difference between the ought, right, and then what is actually happening in reality. So kind of going back to one of our points that both Chase and I have talked through, it really requires a coalition. So, you know, we've seen some providers really work out in the social determinants of health space in terms of just like lending out different kinds of tablets. I mean, we've seen public schools do that, right? In terms of, you know, ever since COVID began with kind of renting out laptops or renting out tablets in order for students who may not necessarily have those means to work at home. And so I think we need to see some sort of very similar initiative in that sense, as well as from community-based organizations. And then, so kind of just this strong coalition of both providers, payers that are investing in the SDOH space, as well as community-based organizations. But yeah, definitely the issue of responsibility and kind of that ROI remains a difficult roadblock or challenge in order to really implementing first and foremost, and then scaling.
Great, good answer. We got another great, I think most people probably participating are wondering, as we do more of these virtual health visits, etc., how do you measure the effectiveness of a telehealth visit from a medical outcome point of view?
Yeah, I think that's one of the things that people are definitely looking at right now. I mean, you know, I've got I'd say probably a couple parts of that. I mean, there's obviously the patient satisfaction side, which is press gainy. Some people are doing it themselves. There's some pros and cons there. The medical outcome side, I think that's going to be kind of a longer longitudinal type look as we look at complex problems and whether or not we're able to solve those with one visit, or if it increases the number of visits. So I think that's a TBD, but something that we got to work on as we work to expand.
I think it's a good point, Mark, and I think another thing kind of corollary to that is, the importance of patient satisfaction is it's going to be interesting as we do more and more telehealth. What is the response from the patients from a patient satisfaction? And that's probably determined as well.
Yeah.
So let's ask you this. Out of all the statistics you talked about and you did this survey, which statistics surprised you the most?
Yeah, that's a good question. To kind of follow up a little bit on what you just said, in terms of understanding consumer satisfaction with telehealth performance, before I kind of answer the stat question. So when we were conducting our survey prior to COVID, and then a little bit earlier this year, ever since the outbreak of COVID, we also had several questions when it came to what their views were on their telehealth, their virtual care experience, assuming that, these people did engage in some sort of virtual care experience. And, my hypothesis going in was that people's experience may decline, honestly, because you see all this demand, and you've also seen a lot of platforms kind of scrambling to keep up with that demand. Chase and I actually worked on a client based up in the Northeast that it was an oncology provider, and our entire project was centered around the fact that oncology patients would use telehealth every now and then prior to COVID, but when COVID really struck and really hit the Northeast very hard earlier this year, everyone went to virtual health. And our provider couldn't handle it from a capabilities perspective, both from a technology platform version, as well as the operations and all of this kind of supporting infrastructure in order to support that. And so we were kind of expecting the experience to decrease. And one of the things that we saw with the stat is that actually the experience overall with the provider, the virtual care provider, either stayed relatively the same or actually increased in some places. Waiting time was not really an issue either. And so that was kind of a good note. And I think more explicitly to your question, with the stat that surprised us the most, I think for me, when we think of demographics, we kind of think of the younger and the millennials, the Gen Zers, to really, really love telehealth, to really at least be able to be a lot more predisposed to using it due to just tech proclivity. And what we've actually seen from our survey, as well as a lot of other surveys done in the space, is that seniors, so we have baby boomers, so seniors 65 plus are actually very comfortable with using technology first and foremost. So from our study, we saw that roughly 80% were comfortable with using technology in general. And then we saw that in terms of using technology as a way to receive healthcare, aka virtual care, only 20% were completely uncomfortable with it. So, you know, we kind of see an overwhelming majority either very comfortable with it or, you know, have a very open mind when it comes to it. So it really combats some of these misconceptions that seniors are just completely anti-technology, and that it's the younger folks that, you know, are really driving this trend. It really is everyone that's driving the demand.
Boy, the questions are coming in here. Here's where someone said they really like your thoughts to anchor or recruit existing independent physicians for telehealth. Are you seeing this happening in hospitals or in systems, in standing up telehealth departments? They're dedicating physicians. Are they using apps? And if they are using them, how are they scaling these apps?
Yeah, I can take that one. So I think most of the providers that we've been using have been using, you know, one of the platforms that are out there. So the Amwell, Hypnosis, those type platforms, and primarily because they needed to be able to scale quickly. So I think that's the reason most of them have done that. In some cases, people are also using their doctors, but I would say more than half the clients, at least I've worked with, I know Chase or Laura, you have a different one, are using those platforms with their own doctors. So I think it's, you know, it's mostly just a scale, and you know, a few of them had a few problems on the scaling back in April, but I think most of them got over all those problems by the mid-May timeframe.
Okay. The other question you and I were talking about, Mark, right before we started this broadcast. Have you gathered any feedback from patients being concerned if insurance covered their virtual visits?
Yeah, so I think there's definitely some concern. I think there's also some confusion. I mean, I think as many people on this call probably know, a couple of the major insurers last week, you know, were waiving copays and decided not to waive copays any further. And you know, for a lot of healthcare consumers, that's just confusing. So you know, some people are confused to the fact, does that mean they won't cover the visit at all? And no, it just means that they're not waiving the copay, right? But there's just, you know, a lot of, you know, the people on this phone call probably have the healthcare intelligence and you know, knowledge around that to know the difference. But there's you know, I think there's going to be a lot of confusion with some of those announcements, and moving forward, I think there's a lot of value. I mean, we definitely, you know, we saw through our survey that there's value definitely accrued here, and it's accruing to the patients. I think that'll be the interesting thing is, you know, if I'm saving time, not having to drive, you're not having to leave work early to go drive to the doctor, to go see the doctor, to wait in the waiting room, you know, there's definitely value to that time. That value doesn't necessarily accrue to the insurance company. So there's a question of, you know, how much are they willing to continue payment parity around you know, doctor's visits versus the virtual visits. So I think that's the other question is, you know, are insurance companies at some point going to force consumers to you know, shoulder more of that burden, but they're also, you know, consumers are getting more of that values. But there's also that begs the question about the confusion.
Let me go back to my previous question because I misread it. When I said apps, I should have said in reference to using telehealth within the hospital and in departments. Also, is it advanced practice practitioners? And I said apps and I misread that.
Laura, Chase, you guys want that one or you want me to take that one?
You got it, Mark.
Okay. So I think, you know, from a specialist perspective, I think that's the other area that we're starting to see it more is, and this is probably started a little bit with COVID, but was really starting beforehand. You know, so one of the challenges with COVID is we're trying to limit the number of people that touch a patient. So, as part of that, we saw people that were having specialists, do the call, do a check-in on somebody through telehealth, or whatever mechanism we want to call it, but virtually. So I think we're definitely going to see more of that. I think the physicians that I talked to, the specialists that I talked to about that, from the rounding perspective, it was a lot easier on them. I think, it depends on the specialty. Some specialties, it's very important to lay hands on the patient. So I think it's going to vary. I think the outcome of this is I think we're going to see it vary by specialty, and we'll just have to kind of see where it ends up.
Okay. Hey, another great question. In your studies, did you gather any consumer insight into receiving virtual care while in the hospital, which is what some hospitals have previously done, especially in rural communities where they'd bring in a specialist virtually? Did you get any consumer insight in that?
Yeah, so not explicitly. Our questions were more directed towards using telehealth as assuming that the person receiving the services were either at home or at work or outpatient, essentially not in the clinic. But I will say one of our again, that oncology provider in the Northeast that Chase and I worked on, that was absolutely one of the capabilities that they were trying to understand how to build out. So a lot of that was for a lot of the patients that were in the hospital, they often relied, the providers, their doctors often relied on other providers giving their second opinions and receiving virtual care that way. And so what they had were essentially within each of the rooms, they had some sort of virtual care device in order for the providers and the patients to be able to have consults with providers from either somewhere across America, even internationally. And so that is definitely absolutely one of the considerations for expanding virtual care, but it just wasn't a focus of the survey.
Here's another great question, really looking at your survey and then kind of thinking outside the box. Do you think, or have you seen, or do you think in the future medical providers could partner with social service nonprofits to help facilitate technology for home telehealth visits?
Absolutely. I think, no, that's a great insight, and absolutely kind of harping on the whole idea of building this coalition, right? Within the community, within providers, within payers, within retail health clinics, and kind of and again, obviously with social services, with maybe even public schools, just kind of throughout all of our both private and public partnerships and entities. And, that's kind of something that we've been seeing, at least from the private side, are a lot of vertical integration plays, and especially a lot of horizontal integration plays, right? I mean, we've seen even to just today, Comcast, which we're all very familiar with Comcast as a telecommunications company, and Independence Health actually just launched a health monitoring platform specifically targeted towards seniors. We've seen Humana, right, this payer that is really focused on Medicare Advantage members, really build out a lot of their virtual care offerings, especially ever since COVID, but they've had a community-based impact and focus ever since, ever since their symbiance and ever since their growth on consumer-centric views. We've seen Teladoc and Livongo partner, which is huge, right? That Teladoc is a huge behavioral health, Teladoc is a really large virtual care provider platform. And then Livongo is this large digital therapeutics platform that kind of focused on diabetes for a while and has just really expanded into many different types of condition monitoring, condition management. And so, in seeing a lot of these different types of combinations within the private space, it's really a question of why not? private and public, and really kind of tapping into, again, the social determinants piece of everything in order to, again, drive access to affordable and quality healthcare that everyone deserves.
Great answer. Questions, and I'm going to kind of combine them. We've had great questions coming in, and these are the final two. You mentioned a lot about rural Texas. Many counties, unfortunately, don't even have psychiatrists. From your data and research, what would you say the demographics in Texas would probably have the most to gain from telehealth? So that's currently. What's going to be the most to gain? That's question one. Question two, looking into your crystal ball, how does Texas telehealth look in 5 years?
Yeah, so, you know, two very, very simple and easy and clear-cut questions. Totally kidding. So I think in terms of the first part, so the demographics that have the most to gain, absolutely the rural and underserved communities. And so, you know, when we speak to rural and urban, we also can't forget that while a lot of the rural space isn't being tapped when it comes to healthcare, and just there's so many financial constraints and underinvestment in those communities, there's also a lot of underinvestment when it comes to a lot of communities, even in urban areas. So for example, South Dallas. And so, you know, as we're kind of thinking about which demographics have most to gain, it is absolutely these two that just haven't been invested in. And, you know, a lot of, you know, you can kind of attribute that to many reasons. Definitely financial is one impact, but, you know, what we're kind of seeing in this market is that there's a pivot, kind of what we alluded to a little bit earlier with one of the questions, to measuring health outcomes, right? And understanding the fact that value-based care is really such a transition from fee for service, and the motivations when it comes to delivering care is no longer a check mark necessarily, but rather a sustained and long-term kind of journey. And so, you know, I would say definitely those two, or the underinvested communities. And then when it comes to, you know, looking at my crystal ball, looking at what's happening 5 years from now within Texas and even nationwide, I would really boil it down to the fact that there has to be orchestration with a consumer's complete healthcare journey. And so that's actually what I've been seeing a lot with my clients in the health strategy space. Is we have so many amazing startups, so many amazing ideas being formulated and kind of executed into fruition. You know, we've, again, like I've alluded to, so many different types of examples of new entrants or disruptors into the healthcare space. I mean, we've seen retail health clinics get into the space. We've seen Comcast, we've seen AT&T, we've seen Best Buy Health, right? We've seen Walmart really nudge their way in, and even now they're planning on creating their own health plan, or they already have. And so, you know, there are so many different offerings. It's almost overwhelming. And the job of all of these is really boils down to, we have to give healthcare to these consumers quickly, easily, and in the most transparent way possible. And then we have to stitch together all of their different journeys. So, you know, when you think about you as a patient, as a consumer, you know, you go to your healthcare provider, you get a list of prescriptions that you may need, assuming you need them, and then you go through this entire journey of getting the prescriptions, following up on condition management if you have a chronic condition, you know, something like diabetes or anything like that. You have to monitor how you're doing, and every step of the way almost requires you to be the orchestrator of everything, and that can be such a burden. But now with all of these different offerings, what it really boils down to is the fact that providers have such a unique ability to already, first of all, leverage consumer trust, because I mean, when I think of getting healthcare, I think of a doctor. I don't think of Walmart necessarily, and that may change, but right now that's just what I think of. But while you are able to leverage all of your trust, really being able to be that one guiding principle in a consumer's life, to be like, we can be there with you every single step of the way. We will make it easy for you. And we will partner with any of these partners and kind of grab them into our ecosystem. So we are no longer seeing these different startups as necessarily competitors. We are seeing them as potential partners that we can leverage into our ecosystem. And in that case, it's a win-win-win for everybody involved.
Well, thank you for that answer. And we have no pending questions. So Mark, Chase, and Laura, thank you for an excellent presentation. And Mark, we'll pass it back to you if you have any closing comments before we adjourn.
I think, we just really think this is a fantastic topic. It's a great opportunity to continue to figure out how to deliver better patient care and to really solve our problems. And so, we thank everyone for spending the time to talk about this issue today.
Well, thank you all again, and thanks for all the people that tuned in. And Chris is going to post the presentation later today or tomorrow. And of course, this will be recorded. So thank you for your support of this particular webinar. And we also want to thank our co-host in doing this today, Accenture, on a job well done. Everyone, have a good afternoon.